I began my association with Carleton shortly after graduating from McGill with a master's in psychological science. Now, this was an applied degree which emphasized the necessary clinical skills for a practicing psychologist. And I must admit that after years of attending university, I was anxious to get on with my life, and this degree made me eligible for provincial certification and thus guaranteed, I can tell you, employability. It was early years for Carleton, and many of us in the community also taught courses relevant to our specialty as part-time faculty. So right after graduation, I was here in Ottawa, and I taught test construction and test administration, as well as some introductory courses. And at the same time, I enjoyed the use of a lovely office with a view in the then new low building. Brand new. And everybody, we all had gorgeous offices. It wasn't until I was offered the position of chief and only psychologist with the then Ottawa School Board that I realized that merely serving as a clinician was not good enough. In this role, I was responsible for providing psychological services for the entire school population of needy students. A formidable task, I think you would agree. And the clinician's approach of taking one child at a time and forming a waiting list was not acceptable in this case. So I decided I needed to look at the whole picture. And this is what I did. By keeping records of referrals to psychology in my first year, I noted that the majority of students needing help from psychology were referred around grade 3. I was curious to see if we could predict high-risk children as early as grade 1 in order to identify potential problems and perhaps even help them adjust earlier in the game. In other words, I had the opportunity to do a longitudinal study, and I had the necessary data available to me. What I lacked was the necessary skills or toolbox to accomplish this. So I sought help of one of my colleagues at Carleton, Professor Nan Donald. It's a long story, but with the help of Nan, I created a behavior checklist for grade 1 children that demonstrated good predictability and reliability, and was published and used by other researchers in the field in their research. Now, needless to say, this initial foray into the world of research became an addiction from which I have yet to recover. In addition to my own practical needs for further training in research methodology, I was also impressed by the type of rigorous psychological research being carried out by the several faculty members at Carleton. Marilyn Marshall suggested I might like to audit her course in learning theory because learning theory was big at this time. But I'm sorry to say I only have one memory of taking her course, and it was that she introduced these things called paramecia. And paramecia are one-celled things that can learn to crawl a maze. But the part about it that I'll never forget was that she also said, and I'm not sure this is true, that they could be ground up and consumed by other paramecia who could then crawl the maze more efficiently. As I said, I'm not sure my memory is correct, but I was on Wikipedia this morning seeing if I could find this study, but it made a big impression. So it was largely due then to Marilyn's confidence in me that I convinced myself to leave my office with a view, my prestigious job at the school board, and descend into Carleton's tunnel, which was where the grad school students had their offices. To many, my choice seemed a little odd, and I certainly didn't feel too confident about it. But at the risk of sounding, as people say, like Little Miss Sunshine, I can honestly say I had a very challenging and exciting time, and I consider it one of the best decisions I ever made. So here are a few highlights of my time at Carleton that I will never forget. The first year consisted of required courses, and as you might imagine, these were the ones I managed to avoid in my previous academic programs. But without these courses, I would not officially be a PhD candidate. Well, the most challenging at the time was advanced statistics, a requirement for any doctoral program. Now, I had managed to obtain credits for earlier statistics courses by memorizing the material, but I knew I really had to understand it if I was going to get what I wanted and to know about the power of statistical thinking in my box of school skills. Advanced statistics was taught by Peter McCormick, and I have to say it completely changed my life. I had had rheumatic fever as a high school student and spent a good part of my grade 11 year at home in bed with a tutor coming to the house. That was fine for most subjects, but it's not good for algebra. And that was the year that algebra was taught in the Ontario school curriculum. Now, while I passed my exam at the end of the year, I never fully grasped algebra. And from then on, and still, I panic at the sight of an algebraic equation. Professor McCormick was an expert at teaching classes of psychology students with math phobia similar to mine. And I will never forget the first exam we took in statistics. No equations were required. We only had to read the problem and describe which statistical method we would use to address the question. Now, this may not seem understandable today, but we were just moving from non-parametric statistics to parametric statistics, and what I learned from him has come in unbelievably often in the course of my life. I will tell you one time when it was really helpful, and I have to share with you an amazing moment that occurred when I was presenting my outcome data from my research on, believe it or not, coronary bypass patients at an international conference several years ago. The conference was actually on methodology. There were a group of researchers from Oxford University in the audience, and they were so impressed by my statistical treatment of the data that they invited me to Oxford. And I presented at Oxford, and I'm thinking, Pete, you would be really proud of me. For some reason, I cannot remember who taught physiological psychology, but I do remember that, again, I was at a loss. I had never even taken high school biology, so I had to fall back on memorizing the textbook in order to try and keep up with the class. But in spite of this, I was fascinated with what I was learning, and I immersed myself in the material with my usual enthusiasm. For the first exam, the professor had asked us not to put our names on our papers, but to use a number system instead, so that he would not be biased in his grading. When he announced the results by calling out the numbers in order of the highest grade, mine was the first one he called. When I got up to receive the paper, and this is a true story, he looked at me in shock, and he said, "You?" I guess Freud would have an explanation of why I can't remember his name. One of the most important courses for me was the requirement to take the history of psychology, and that was given by Bob Wake. I still feel learning about the pioneers in the field taught me a way of looking at research problems today. Unfortunately, I think this is no longer a required course, and I find myself one of the few practicing psychologists who still look at new ideas through the prism of our discipline's history. Dr. Wake's course is one of my most significant memories, and it still has an impact on my work today. Now, the most important person in my life is right here, and it was Tom Ryan, and I really can't thank him enough. When Tom arrived at Carleton, he made the mistake of saying that one of his goals was to graduate the first PhD. That was a challenge I cannot resist. I immediately applied to the program, and he tentatively agreed, depending on my performance in the courses that I needed to take in order to be eligible. My favorite course with him was a graduate seminar, where students read articles and then met to critique them. And it became a game to find as many flaws as we could, and I still enjoy Journal Club today. I also find it very difficult to carry out my own research without considering the standards necessary for doing so, which become ingrained after you spend a year doing this in Tom Ryan's class. As a result of my time at Carleton, I can only say I continue to love what I have continued to do as a developmental psychologist to this day. Thanks to the training I receive, I now have a full toolbox, which enables me to read the literature objectively, to respect the need for good research design, and meaningful based conclusions. I'm going to take a sip of water here because I'm running out of voice. Since graduation, I've never stopped being a clinical researcher, working in the applied field and conducting research at the same time. Although I worked in the United States for almost 30 years, when I returned to Ottawa in 2001, Professor Peter Fried encouraged me to return to Carleton as an adjunct professor, and I continue in that role today. One of the best things about my training is the opportunity to use this toolbox in any kind of setting with a problem relevant to psychology. So I'll close by taking a few minutes to give examples from my own career to illustrate the way in which I have used my personal toolbox to help solve practical, real-life issues. Shortly after leaving Carleton, I became interested in expanding my theoretical knowledge about child development to include the world of Jean Piaget. We were very behavioral at the time, but I was able, to continue on doing this. And through another amazing opportunity, I had the good fortune to work personally with Piaget in Geneva and to conduct research on Piaget's theory of moral development in collaboration with his colleague Barbel Inhelder. Any details of these I'm happy to talk about at the banquet tonight, how that happened. This was a perfect example of the marriage of theoretical knowledge and practical skills. My aim was to develop a standardized instrument for assessing level of moral development based on Piaget's original moral dilemmas. He was still alive. He had actually used the dilemmas in the schools, public schools in Geneva, and we were able to do this task. The work was ongoing for several years and not only provided supportive evidence for the validity of Piaget's theory, but also its universality through collaborative work with researchers in other countries. I also used this work in a collaborative project with Dr. Bill Curtinas of Florida International University. And the ultimate application of the instrument came when it was used to support the state of Florida's juvenile justice system rehabilitation programs. The data actually supported the hypothesis that juvenile offenders are immature in their level of moral understanding, and that they could be helped through intervention to develop higher order moral reasoning, typical for their chronological age. And what I really liked was not only that the results came out this way, but that the outcome variable was decreased recidivism, which is a very socially important variable indeed. My toolbox was essential to me when I was asked by the Florida branch of the American Heart Association to design and implement a study on depression following coronary bypass surgery in the 1980s. I used my clinical skills to access the theoretical literature and develop a short clinical support program, which was effective in lowering depression rates among treatment subjects. The improvement was noticed right after the surgery compared to the contrast group, but it continued to remain 3 years after surgery. I always like to do a long follow-up. I presented the results of this research at major international conferences and published them in 2 books, one academic and one for patients and their families, who still buy this book today if a member of the family is having coronary bypass surgery. So there's your combination again. Prior to returning to Canada, I was Associate Professor of Pediatrics at the University of Miami School of Medicine, where I applied my skills to exploring the relationship between environmental factors to long-term outcome of extremely premature and medically compromised infants. We were able to do repeated measures over a 3-year period from birth until they were 3 years of age. And I also looked at the factors which related to successful intervention programs for these high-risk children and their families. So although my career path has been winding and certainly eclectic, my main area of interest has always been the child who is identified as emotionally at risk. I have followed these children in one way or another since my early days at the Ottawa School Board, where I established a demonstration class for children who were then called emotionally disturbed. As a psychologist currently for the Ottawa Carleton School Board, I was incredibly lucky to be offered my current role of psychology coordinator for their provincially funded autism program. This has enabled me to immerse myself in the autism literature and establish intervention strategies for children with this diagnosis. I also had the opportunity to teach a course on autism last year. The mystery of autism has not yet been resolved, so it's the perfect place for me to be. While I do not have an answer to the enigma of this diagnosis, my long experience as a psychologist has made it possible for me to take a longer view of the subject, and my current position has given me access to these children on the spectrum. Now, as there will come a time when I decide to retire, I thought it would be a good idea for me to put my thoughts on autism on paper for others to think about. So I have just completed a book which includes descriptions of the history of the diagnosis and some comments on the current status of the reliability of the diagnosis, among other things. The title, I think, is going to be, it's a working title, The Autism Story, and it's at the publishers with an expected publication date of January. So in summary, I guess I don't need to tell you again, I could never forget that Carleton made this long and fascinating career possible for me. So thank you.